I'm your host, Neil Howard, here on Health Professional Radio. Thank you for joining us once again. We're going to have a conversation with Mr. Martin Burns, CEO of BBI, or Bruin Biometrics. He's joining us on the program to talk about the prevention of pressure injuries. He's also going to talk about the recently updated guidelines by the National Pressure Injury Advisory Panel and some of the financial impact of pressure injuries. Welcome to the program, Mr. Martin Burns. Thank you for taking the time this morning.
Thank you very much for the invitation. It's great to speak to you.
Give us a brief background about yourself and your company, and then tell our listeners what a pressure injury is, okay?
Yeah, so I'm the CEO of Bruin Biometrics. We're a company that develops preventative solutions that are all revolving around three basic principles. Number one is we pick areas of care with very deficient diagnostic standards that are hindering healthcare practitioners and patients in their journey towards recovery. Mm-hmm. Number two is we use technology. And the type of technology we use are sensor-based technologies. And I'll explain one of those in a moment. And then thirdly is we use safety systems viewpoints. What that means is that there are some wonderful literature and some really good principles in place in healthcare. And your listeners will have heard of the seminal book, To Err is Human. And we use some of the principles from that, and then also the principles from a book by Nancy Levison called Engineering a Safer World. And the whole principle here is that there are ways of organizing ourselves that drive towards a preventative outcome. And that's what we do as a company. My background is in developing the business from essentially a fledgling business into now a fully commercial business using these principles.
Now, as a preventative company, are we talking about positioning ourselves and our lifestyle so that things don't happen to us on any level, or are there specific things that we're preventing?
You know, it's a conversation I have with regulators and policymakers and government officials all over the world. What we're specifically focusing in on here is on pressure injuries, or otherwise known as pressure ulcers, and sometimes colloquially known as bed sores. Okay. They're wounds. And essentially they're wounds over bony, prominent areas. Think about, your heels or your sacral area, trochanters, and increasingly actually medical device-related pressure injuries. Think about masks that press down on the bridge of the nose and so on. The type of prevention that we focus on in epidemiology, there are a number of different stages of prevention. And what we do is we say, look, these are the types of injuries that are actually impossible to avoid fully, meaning there are times when even the early stage biomarkers are going to occur. Mm-hmm. So we needed a definition of prevention. And the definition of prevention that we use for pressure injuries is we want to make sure that patients have the ability to keep their skin intact. Keep the skin intact. Pressure injuries are graded. They go from intact skin all the way down to what are referred to as full thickness ulcers. In other words, they're injuries that go right the way down to the bone. Think about a patient with their heel bone being visible on the bed surface. So what we do is we focus very hard on those early stages of the injury, and we focus then on tying our data to treatments that allow nurses and nurse practitioners and healthcare practitioners to help their patients keep the skin intact.
Well, it would seem that you would have to be able to determine when the pressure injury is in its earliest stages. Is there a way that you can determine that there is going to be a pressure injury before any visible signs?
There is indeed. The methodology that we researched and employed is the following. So a pressure injury is a wound. Mm-hmm. Substantially all wounds go through the inflammatory phase. So think about, when you hit your hand last time with a hammer, presuming it didn't bleed, what happens? It swells up. What is that? That's swelling, that's inflammation. Now, the inflammation is very, very useful information for a healthcare practitioner. So let me give you another analogy. A pressure injury, if you've ever seen a boat moving through water, a pressure injury is a bit like the boat. It's essentially an accumulation of dead and dying cells over a bony prominent area for example, a heel. But preceding it and all around the injury is water in the form of a wave. And so what you see is this inflammatory wave through the skin and tissue, propagating up from where the wound starts, right the way out to the skin and tissue. Now, you can't see it, not visible. The current standard requires that nurses do visible inspection and also what's referred to as palpation tests, literally putting their thumb onto the skin and tissue to identify whether there's bogginess in the skin. So what we did was we said, actually, there has to be a technology solution to this. Is there a way of actually measuring what's going on at the site that isn't measuring the actual ulcer? You'd have to do a physical biopsy for that, but rather is it measuring the early stages of that injury? And the answer is yes. So in the International Clinical Care Guidelines, the ones you referenced earlier, the NPIAP guidelines, which they partner with their European colleagues and their Asia Pacific colleagues, they've now recognized in the chapter about why and how pressure ulcers occur, it's referred to the etiology chapter, that one of the biomarkers of early stage development of a pressure injury is localized inflammation, otherwise known as subepidermal moisture. And your listeners may also know it from their own clinical training as localized edema. And the answer is this: healthy skin and tissue is not inflamed. What that means then is that when you take readings with our scanner, what you find is that healthy skin and tissue over the bony prominent areas gives broadly similar values. You take 4 readings over the heel, you take 6 over the sacral area, and if they're the same or broadly the same, it means there's no inflammation that's abnormal in that area. Once you get a big difference, a difference between the high and the low within the 4 readings or the 6 readings, what does that mean? Well, that means there's an abnormal set of readings. And what that means also is if you don't take action on that site, the probability is that your patient will then go on and develop a PU at that site. So what this is doing is now providing nurses with the ability to add to their intelligence, add to their clinical decision making, to say with a particular patient, I can't see any redness on the skin. I know my patient's at risk, but this piece of technology is telling me there's an abnormal reading. Let me take some action. Now, what are those actions? Well, they're very basic. They're offloading the heel. They're offloading the patient to make sure that their pressure, which has been exerted on that site, gets alleviated. They may choose to put the person on a heel boot. They may choose a dressing, which can alleviate some of the pressure and the shear. And they may change the surface of the patient is lying on. So very basic interventions with using this very early stage anatomy-specific information.
And these are interventions that will be useless once the skin goes through certain stages.
There is a point at which you're 100% right that those interventions stop being preventative and then become treatments. You're absolutely right.
Where can our listeners go get some more information about your organization and about the National Pressure Injury Advisory Panel as well?
Yeah, so there are 2 websites I would point people to. Let me first of all point you to the National Pressure Ulcer Advisory or Pressure Injury Advisory Panel, which is NPIAP. A Google search will show you that link, and I think it's npiap.org. A terrific organization, and there's a link there to the clinical guidelines. Along those same lines, actually, the AAWC, the Association for the Advancement of Wound Care, also has terrific resources online for practitioners to really do more research about pressure ulcers and pressure injuries. And then our website is SEM-scanner, SCANNER.com, SEMscanner.com. And there are loads of videos online as well with, what the scanner is and how to use it.
Well, Martin, thank you for joining us on the program this morning, and it's been quite enlightening. Thank you very much. Appreciate it.
Thank you very much for your time. I really very much appreciate it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Mr. Martin Burns, CEO of BBI. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.